will be 2 billion of us on the planet over 60 in the next couple of decades. And even more interestingly, as every society modernizes everywhere on the planet, more old than young. And so this idea of aging has been with us for a while. We are now in the year of the decade of healthy aging, the start of the decade of healthy aging by one of your sister agencies, the World Health Organization. And so our engagement with COVID-19 is unfortunately very, very substantial, obviously because of all the broad demographic categories. An older person, particularly one who is compromised, immunocompromised, will be more challenged and at risk with respect to the current COVID-19 pandemic. So here are 3 points that I would suggest and leave you with. Number one, whether we're talking about in or outside COVID-19, design for the 55 plus or 60 demographic, as Anthony suggested, is designed about diversity by itself. Again, whether inside or outside COVID-19, there tends to be a lens which many instinctively apply to this older demographic, assuming everyone is the same. A healthy and active 57-year-old has a different set of needs than a very frail 86-year-old. That's true generally, and it is through the lens of ageism, perhaps one of the last acceptable forms of discrimination, to be very blunt, that the decade of healthy aging will address. So number one, the diversity you mentioned broadly is even as much applicable for an older demographic, and we have that strategically through the Global Coalition on Aging. Secondly, to be very clear on the role that we're attempting to play, it is working with and advising the private business sector across the globe with respect to meeting the needs for a more healthy and active aging. And that, again, couldn't be more true in COVID-19. So let me just leave with 3 areas that require further exploration of what we're seeing, what we're learning, and where the absolute applications of universal design and social innovation must apply in order for success within COVID-19 pandemic applications today and post the COVID-19 crisis. We all hope that we'll get there sooner rather than later. Number one, elder home care, which is relatively small cottage industry, in many ways started in its current form by 2 entrepreneurs, Paul and Lori Hogan, out of Omaha, Nebraska, and now is a global sector. Home instead senior care is global. They are on the front lines of COVID-19. And what we're learning from them about the needs of elder caregiving within COVID-19 are very, very significant. And that will lead to the most important change post-COVID-19, which is elder caregivers becoming a central part of our health ecosystem. Today, we think of our health ecosystem in terms of nurses and healthcare professionals, physicians, of course. Elder caregivers within COVID-19, we are staying at home, are on the front lines, and they will be part of health transformation in the post-COVID-19. So what do we apply to that sector for further innovation and learning in the context of design? Secondly, our technology companies. We are at a place, and there was a reference in a news article about a week ago, that in the context of COVID-19, with respect to telehealth, telemedicine, remote care, remote patient monitoring, we have made more advances in a week than would normally take that sector 10 years. And obviously, again, that's because of the applications required to be out of the hospital, even for acute care, particularly needed in a 60, 65 plus demographic, and particularly in a frail 84-year-old, for example. So how can, going forward, applications of design of the sort Anthony you so brilliantly laid out be learned for that application? And the third area is medicine innovation. We all know that the only time we're going to feel truly more confident as we attempt to open up our economies is when there are innovative therapies and, most importantly, a vaccine or vaccines available. We hope that will come sooner rather than later. How can universal design and social innovation apply to further advance the innovation progress that we want in weeks or months and not years? Normally it takes years. And again, as you so well described, Anthony, how can that apply once we find these innovations to ensure the scalability and access to everyone on the planet, whether you're in a village in India or in New York City, as I am. And that is utterly essential. It's not new, but COVID-19 brings that message home. So thank you for having us as part of this, and we look forward to the discussion in the next few minutes.
Thank you, Mike. I sincerely appreciate you taking the time to present with us today. We'll turn the microphone over now to Masahito Kawamori. Masahito, are you on the line?
Hello, can you hear me? Hello?
Yep, loud and clear, Masahito. Go ahead.
Okay. So thank you very much for this opportunity for me to speak. My name is Masahito Kawamori. I'm the rapporteur of question 26 of study group 16, which is dedicated to the study of accessibility to multimedia in International Telecommunication Union, T-sector. T-sector is for telecoms. I'd like to talk today about standards and standards for accessibility and why standards are important for accessibility. I'm the rapporteur. The rapporteur is like a chair, a coordinator in discussion, and we invite persons with disabilities to our meetings so that we can all discuss how we can make ICT, information communication technologies, accessible to persons with disability, as well as to persons with age, as well as other disprivileged people. And I had an opportunity to discuss with WHO, World Health Organization, about the importance of standards when there was an Ebola outbreak in Africa a few years ago. And we had a discussion. We had a big room full of people from different countries discussing how standards and ICT can help healthcare with WHO. And they were talking about how people were willing to donate many good apps and hardware, smartphones to Africa, but most of them were unusable because they were not interoperable, because they were not standardized. I think this is a very good lesson especially in the time of emergency. It is imperative that we can use standardized products, standardized applications, standardized tools, so that people don't feel people cannot find how to use those things. Standard is like a language. it's very important that you get used to this standard so that people can communicate, people can interchange, people can exchange, interoperate. So this is extremely important, and especially important for accessibility, because people with disabilities, persons with disabilities, are not, how should I say, well trained, specially trained for different devices, different applications, different tools. So for example, this tool that we're using now, it's Microsoft Teams. I don't know how accessible it is, but if it's standardized, then it should be easier to be used. There's a tool called Zoom, there's a tool called Skype, there's a tool called WhatsApp, different things, but they're not all standardized. And sometimes some people find some tools easier to use, some people find other tools easier to use, blah, blah, blah. So that would be very, very difficult. For example, I can't find the caption here because it's not standardized. The user interface is not standardized. So in ITU, our team, our group, tries to standardize ICT tools and applications and services in such a way that persons with disabilities find them easier to use. For example, we have standardized remote meeting so that we can have a standardized way of making meetings, remote meetings, more accessible. Or we have standardized with Anthony a way how to navigate people with audio guidance. Or we have standardized ways how deaf people can talk to hearing people with telephone, which is called telephone relay service. And at this time, COVID-19 pandemic is especially, should I say, it's a good showcase of standards because, and especially for ICT, because everybody is sort of, forced to stay home, stay where you are, stay inside. And remote participation is the only way that you can communicate, especially for persons with disabilities. But at the same time, it's kind of interesting that this makes everybody sort of equal because everybody's remote from each other in a way. So ITU is trying to help persons with disabilities with standards, ICT standards, to be able to communicate and to lead to better life with ICT. For example, I'm working with the persons with disabilities, deaf people in the Philippines because they're locked down and they were not allowed to go out. And there is only one way they can communicate, which is the web. So we're trying to introduce remote sign language interpretation in the Philippines and also in other countries. So these are the things that we can provide, and this is only possible through standards, because otherwise, if you have proprietary solutions and products, the universal design will not be achieved. And standards are essential in this kind of universal design, especially in the emergency situation like COVID-19 pandemic. So that's my talk. Thank you.
Thank you very much, Masahito. I sincerely appreciate the time you took to meet with us today. So just to take a moment to address some of the questions that have been coming through. The organizers of the WSIS TalkX have implemented this automatic captioning system in the hopes that it would provide some accessibility features and functions for persons who are deaf or hard of hearing. We understand that there is not working very well, and it will be reviewed and it will be improved for the next meeting. If we're able to provide some kind of quick fix solution, then we'll do our best to make that happen. And of course, we'll appreciate your patience as we continue to make improvements to this and the WSIS forum generally. With that, I'd like to open it up to a general discussion about the topics that we've dealt with today. I know we had one question come up during the presentations from Christian Simonsen, and we'll take that question in a moment. And then if anyone else has questions that they'd like to post now, it would be really great to hear from you. So please take the time to add that to the question and answer feature. And myself, Elisa, Michael, and Masahito will do our best to respond to those questions. So to start off with, Christian asks, I would like to know whether or not accessibility awareness can be promoted in these times, in these special times. He says that even in Scandinavia, there is inaccessible emergency information. And I think this is a really excellent question because it opens up the challenge that we experience when it comes to raising awareness around this really important issue. And I think that one of the key approaches that I have found to be most effective is putting together forums and opportunities for diverse stakeholders to connect with one another. This means bringing government, it means bringing industry, academia, civil society together to create some solutions for these really challenging issues. And I think that's one of the best ways of fomenting movement and continuing to develop people's awareness on this issue. But I would just ask Elisa if you, Masahito, or Michael have any suggestions that you would like to chime in with. Please go ahead and just unmute yourself and speak at will. Michael, would you like to comment?
Sure. Well, thank you. It's a very good question, and one that relates to a point that Anthony, I think you made about the critical importance of communications in this, particularly in a COVID-19 crisis, but obviously important generally. We're finding that the scalability of easy to understand and effective communications is so important. And again, understanding this across diverse populations, whether you're talking about geographically or demographically or whatever it is. You know, obviously the importance of the social distancing message or wearing masks, the importance of the balance between our own approach to health matters on the one hand, and all of our desire around, quote unquote, opening up our economies again. This kind of messaging is so critical, and in a way, for the first time, we have the world listening to this. Obviously, each of our leaders, whether it's state by state in the United States or at the federal level or different countries, but the importance of this communication is so absolutely critical. And the inclusion through, as you say, universal design in how we communicate, that's going to become at least as important, as I said earlier, when we get to the place of having therapies and vaccines to ensure the right kind of compliance. So the short answer is great question, and we think it is critical. We think we're learning literally every day, certainly in my world with application to the, let's say, 60+ demographic, but whatever we learn there will have application for everyone.
Thank you so much, Michael. Lisa or Masahito, would you like to respond to the question? Okay, so then I'll just thank Christian Simonsen again, and he is with Fossil Call Technology. We'll move now to another comment by Nawar Al-Awa, and I apologize if I've mispronounced your name. She's from, or they're from UNESCWA. They suggest that to include services in addition to products and processes, and that e-services that are accessible and usable are much needed during COVID-19. And I would just agree sincerely that that is a incredibly important and vital issue to deal with when it comes to any emergency situations, whether that's COVID-19 or even just day-to-day kind of local and national emergency situations. There's been a lot of really great work that has been done on this, but there's still miles and miles to go. So I think it's something we have to stay vigilant about, and it's something we have to continue to press both public authorities as well as private sector and academia to continue to consider solutions that are accessible and usable in terms of the public services and the private services that are available in any of these emergency situations. Michael, if you, Elisa, or Masahito have any comments to make, I'll just give you a second to respond. Okay.
Well, I do, but since I've already spoken, I don't want to. If others want to go first, please go ahead, Elise or Mash.
No, you go ahead, Michael. I have no further comment.
Thank you. Well, one of the lessons that, as you're suggesting, we're taking away from the pandemic crisis, but should be applicable always, is to ensure that we're not only designing good technology solutions, but we're also thinking about training people to implement and manage those technology solutions. An example that we're experiencing is technology to provide food or groceries to any of us who are inside, but in particular to many of the older people that are inside homes, which our Home Instead Senior Care is working with, for example, elder home care, but also inside institutional settings. And, going online with what appears to be a nice piece of technology to order those groceries doesn't work if you don't have the workers on the other side understanding how to access it, how to even engage within their own companies and distribution systems to very rapidly feedback on what's working and what's not working, what has to be managed. I think we've all probably had these experiences, and particularly with older people who are inside, shall we say, and need groceries and are, or other kind of essentials. And the technology is there, and one assumes it's going to work, and oftentimes it's not working. So what's the training of the professionals or managers around that, both for this crisis situation, but also, as we say, what we're learning to apply in general?
Thank you very much for that comment, Michael. That's very, very interesting. There's a couple of anonymous questions, so I'm just going to answer one of the easier ones first, very quickly. An anonymous participant asks, which standards can a typical developer use to make websites that are more accessible to everyone? And so I would just direct that and the rest of the participants to the Web Content Accessibility Guidelines. And you can just throw those 4 words into Google and you'll find the website for the World Wide Web Consortium, and they publish standards for website accessibility. Those are the state-of-the-art kind of cutting-edge standards when it comes to web accessibility, and they're easy to follow for both the developer as well as business managers and others. The next question is directed at Elisa. So this is from Eric Kaufmel at Autistic Minority International. And Eric has a really great question about hackathons and accessibility. He asked that many competing hackathons are taking place right now, but how accessible are they, for example, to persons with disabilities to participate in and contribute? He does not remember ever seeing any information on accessibility or universal design of hackathons, And Eric, since you come from Autistic Minority International, I think this is for persons with autism is especially important. So Elisa, could you respond to that?
Yeah, this is exactly why we need to talk about this, and it's also why my organization exists, because what I have seen, I've also seen, like I mentioned, a lot of hackathons, and most of them do not have a lot of information on accessibility. Some of them actually work on universal design without being very accessible themselves, while others do. So there is definitely room for improvement there. And yeah, that's basically what I have to say, that we really need to talk about that, so that these hackathons are also accessible, because like Anthony mentioned, it's incredibly important if we are also going to create inclusive innovation. We have to invite everyone into these hackathons and co-design together with real users. So yeah, it's very important.
Yes, and I'll just add to that there are some guidelines for event accessibility, but the hackathons and innovation camps are often used very highly interactive activities that can be especially taxing for certain people. And so I think it's important that we adopt the guidelines and the standards that are already available for event accessibility, but we also continue to develop new guidelines and accessibility requirements for these sorts of events as they continue to evolve. So then thank you again to Eric for that question. It's a really important issue to bring up, especially in this forum. So next we have an anonymous participant asks, first, he thanks the speakers, or they thank the speakers, and then they say that Michael Hoden mentioned some ongoing research initiatives on how elder home care can be redesigned after COVID. Michael, could you just repeat the name of this initiative or provide other resources?
Yes, thank you, and appreciate the question. I was referring to, I think, one of our Global Coalition partner companies, which is Home Instead Senior Care. They're based out of Omaha, Nebraska, but with operations in about 20, close to 15 or so countries around the world, including, interestingly, in Wuhan, China. And they're literally, as we suggested, on the front lines, not only every day, but every hour, where they're serving seniors who need care, everyone from those who are very serious dementia or Alzheimer's elders who need the home care they provide, and they have special training there, to those who might have, as we've all alluded to, elements of, vision deterioration, or just need help in daily living. And Home Instead, like many of their colleague companies and others in the public sector who are involved in home care, in America, obviously through Medicare, but more and more, or the NHS in the UK, but more and more the private sector elder home care, are balancing between the absolute essential need and the cornerstone of their business of personal touch, the relationship-based care that they provide on the one hand, and bringing in technology on the other hand, which of course elder home care at the cutting edge has already been doing, but COVID-19 requires even more. So how can an elder home care provider with your 86-year-old mother or grandmother use telehealth to show a doctor, shall we say, or a nurse on this telehealth piece of equipment, or it could be Zoom or Skype, as we've already alluded to, a rash on their arm that they're concerned about, or a way to show and describe in real time several symptoms they may have, which they may think it's COVID-19 and may or may not be, but get a get a pretty good diagnosis without going to the hospital, which of course may be difficult. And if we can keep everyone out of the hospital, that's obviously much better. So those are some of the things that we're seeing. And we think that although those, like so many things else in any crisis, whether it's a war or a current COVID-19 pandemic, business and innovation that had been already underway gets catapulted to the front. And we're seeing this in home care as well. I hope I've answered the question, but I'm happy to take it again.
That was excellent, Mike. If anyone else has any comments to make, I'll give you a second before we move on to the next question. All right. So
I have a question for our colleagues.
Sure.
And it's, how do we balance, or what is the balance between standards, which totally understand, and innovation? So for example, there was the mention of even the use of this video itself. We're using Microsoft Teams. We might have used Zoom. There are 2 or 3 others. On the one hand, there's an element of the importance of standards. On the other hand, we want to ensure continued innovation. What's the balance there?
I think that's a really excellent question, and I won't, well, I won't respond, but I think Masahito might want to say something since he's so heavily involved in standards. Masahito?
Okay, thank you. It's a terrific question. Actually, standards do promote innovation. When you think about the web has been created because of HTML. HTML has been standardized by W3C, and that's why we have this World Wide Web, and that's so innovative. So actually, standards do promote and generate innovation. That's my quick answer. If you look at things, I mean, Apple is actually a very, very innovative company, but also it's very, very much embedded to standardization as well.
Thank you, Masahito. That's excellent. And I would just, since we only have a few minutes left, encourage the other speakers to keep their responses to the point. So we have another anonymous participant who's asked, what are some of the challenges for adopting universal design? They say that businesses want to be viable, but they're looking for scale, and being innovative is not just to search for solutions, but also to compete. And I agree wholeheartedly. Universal design can provide a very competitive edge to a lot of businesses. One of the key driving value creation drivers of Apple has been a universal design approach to their technologies, and they've achieved quite a bit of success for that. And I think you see that with a lot of new companies coming out who are adopting universal design principles and who are able to quickly introduce and scale their ideas and their businesses in a really big way. So I think this is going to continue to be an important feature of the business landscape ongoing. And of course, universal design opens up much larger markets than approaching a technology design without universal design. The next question comes from Madeline Sherb. She asks, what about Africa and innovation? And I think, again, universal design provides a really key opportunity for sustainable development, especially when it comes to transferring technologies from the global north to the global south, and of course, from the global south back to the global north. So I think there's huge opportunities for Africa to really lean in to universal design as an approach and kind of leapfrog a lot of the countries in the global north in their adoption of these issues and these principles. So thank you, Madeline, for that excellent comment. Other speakers, if you have thoughts, please give me a red light so that I don't move through these too quickly. We do have three plus questions to go through, so I'll open this one up to the rest of the group. Someone named Marwa has asked whether the universal design and social innovation apps and tools for those that can use technology are great across the globe. But what about those who don't have basic communications, technological tools, as street children and even families, for an example? Is there any successful innovative solutions? Michael, do you have experience with this?
Yes, we do. Thank you. And the short point I would make is that in the demographic we're focused on, namely again, let's say 60 plus, the one thing I can offer to the questioner as perhaps a guide more broadly is that there is far more technological savvy, capability, and desire than the received wisdom suggests in this group, and that may be true among many other categories of people, whether it's demographic or others as well. So each diverse category may have particular needs, but one thing we should do is make sure we have the market research, the evidence, and the data about what the real capabilities and desires are, and not assume, for example, in our category, well, she's 78 and, you know, what does she know about mobile phones or computers or other applications of technology? The short answer is a lot, and it's growing every day. And besides, in 10 or 15 or 20 years, today's older population will be ones that, you know, some of you, my colleagues on the phone, is just looking visibly, who have grown up with technology. So let's think about the world in a much more open and transparent way than our preconceived notions.
Excellent. Thank you so much for that comment. Elisa, Masahito, do you want to say anything before we move on to the next question?
That's a good point.
Add something that our company.
Okay, so we'll move on. The next person has asked from Ahmed Mahdavi. He's at the University of Tehran and Sustainable Agriculture and Environment. He asks, are UNEP and other related world authorities taking the opportunity to reconsider laws and regulations for a better and cleaner world after COVID-19? And I think that's a general question about the authorities' responses to COVID-19. Well, this is not directly in line with the topic of today's presentations. I will simply say that we hope so. Any kind of global crisis like that should provide all of us with an opportunity for critical reflection, and that goes for government as well as all of the other sectors of society.
So sorry, just to jump in, I can give you a very, actually a very positive response to that question. In the three innovations that I alluded to that are elder home care, let's say remote patient monitoring, telehealth, telemedicine is the second, and the third is innovative medicines. There are two areas of change that we see literally every day that is supporting expansive and very rapid innovation in a way that it didn't happen pre the COVID-19. One is in payment flows. In order to get innovation, we need money. And you're having reimbursement, for example, from governments. You're having private sector firms that are already stepping up to pay for telehealth, for example, in a way that it wouldn't have done, 2 months ago. Home care is another example where you're getting a kind of flow. The second is regulatory relaxation. To the degree we still have to be careful about that, but you're getting regulatory relaxation everywhere to try to get the kind of medicines and vaccines that we need. So the short answer is I'm actually remarkably optimistic about this.
Excellent. Thank you, Michael. So the next question comes from Rahul Jha of the ITU Telecom. He says, thanks to everyone for your insightful perspectives. His question is about the deaf and other communities. To what extent are they themselves included in the universal design standards instead of being confined to the role of end users of the products and processes? I can speak to that, but I'm sure Masahito will have a follow-up comment to make. I know ITU, the work that I've been involved in at the ITU in terms of standardization has involved persons with disabilities rather extensively. I know that the EU has a set of guidelines on universal design and standardization. So that's also a really excellent set of criteria for involving substantively persons with disabilities in the standardization process. And so I'll turn now over to Masahito so he can comment more on Rahul's question.
Yes, exactly. Yeah, Anthony, thank you. That's I totally agree with you. In ITU, we invite different groups of deaf and hard of hearing people from around the world, and also we collaborate with ISO, which also has some hard of hearing and deaf and hard of hearing people involved. So we have and we have a very good relationship with WFD, World Federation of the Deaf, and also representatives from International Federation of the Hard of Hearing, as well as the European Federation of the Hard of Hearing, are represented at our meeting. So I think they're not confined to the role of the users, but they are trying to standardize what they think they need to do.
So just very quickly, sorry, this is Michael Hoden again. The sensory perception loss as one ages has always been a huge topic, and it's obviously part of COVID-19. We're talking about vision loss, deterioration or loss, hearing loss, etc. And Gitanjali, as you know, again, your sister organization, WHO, inside the decade of healthy aging, that is a very, very critical topic. It's being applied even today as we speak inside the COVID-19 pandemic crisis, but work in that area driven by the particular needs as we age. So solve the problems for 70-year-olds, it's going to apply to 20-year-olds. Again, the design application that you say.
Excellent, excellent. And I think we'll take this last question just to wrap everything up from Ahmed Madavi, again from the University of Tehran and Sustainable Agriculture and Environment. Ahmad asks, what would be the universal design for oil and gas and plastics industry who are most affected by the COVID-19? Are they going to continue as before? And I think, Ahmad, it's such a great question to ask because I'd never considered universal design in relation to those industries. And so I think there's opportunities here to continue to creatively explore and look at how innovations and especially how universal design can continue to accelerate growth and to ensure that the oil and gas and plastics industry are being socially responsible in their work and ensuring that they continue to buoy the economic development of the world. Any thoughts on that before we close everything out from the other
Well, when
panelists?
you think about an area like that, which I agree, I had never thought about, but I would just remind us to go back to the opening, Anthony, that you gave, which is the universal design application is not just about the product, but it's also about distribution, manufacturing, distribution, and therefore scalability. So there may be applications for the product of what you suggest, but there are certainly applications to ensure access scalable globally, which currently we may not have.
All right, with that, we'll go ahead and wrap up. I have 1500 on the button on my clock, so I'll thank the panelists again. And I sincerely apologize to the participants who were not able to have their questions answered, and to those participants who were affected by the issues related to the captioning. Again, we sincerely apologize. We've tried to put in as many fixes as possible, and we will continue to improve this process for the next week. Gitanjali, would you like to sign us out?
Thank you, Anthony. Thank you to all the other colleagues, Michael, Elise, and Masahito. It was a great debate and a great dialogue. We will keep working to fix the platform, and we sincerely apologize for the captioning issues faced today. Thank you very much, and please join us on Tuesday for the next talks on information to journalists during COVID-19 by UNESCO, EBU, and other colleagues.
Thank you.
Thank you, and with that, we'll close the session.
Thank you.
Thank you
Excellent.
very much. Goodbye. Thank you. Yeah, it's wonderful.